Away from that, Ghana could be faced with a public health crisis in senior high schools. In a matter of weeks, 6 students have died from disease outbreaks in their schools, the most recent of which being a first-year home economics student of Damongo Senior High School in the northern region who reportedly died of meningitis. 9 students have been hospitalized since that outbreak. Now, at Koforidua Senior High Technical School in the eastern region, 1 student died and 22 are on admission. These come after the H1N1 outbreak in Kumasi Academy, which claimed 4 lives and hospitalized 44 at a point. Now, these, of course, have been discharged. Now, this trend has raised concern about the safety of senior high school students in Ghana, particularly at this time of the year when diseases like meningitis are more likely to break out. Eastern Regional Minister Eric Okwache therefore says his outfit is taking immediate steps to improve the conditions in senior high schools in that part of the country.
He's not proposing a doctor per se, but a health personnel, paramedic, a senior nurse, probably those who have retired and are still strong, they have the knowledge, they have the skills. You see, my sister, now we are having numbers, huge numbers in the schools. Some have more than 2,000. Some have even 3,000 and more. And we are proposing that in view of the huge numbers and in view of the fact that we are human beings, and it is not as if the house masters and mistresses are sleeping with the students in the same dormitories. They live in their bungalows. Some even live outside of campus. And so we are thinking that in the wake of what we are all experiencing, certain diseases, particularly this time when we have abrupt weather changes, extremes of temperatures, and we are all prone to certain airborne diseases, we are thinking that it should not be too much for an institution with about, maybe if you add the staff, 3,500 people, to have a resident paramedic on campus, so that in the event of somebody being affected by a certain malaise, some first aid could be given. And they don't have a functional infirmary in the school. So that is our fear, and that is our what we anticipate, that if GS could adopt this line of action, it could help all of us.
When you engaged the ministry and the Ghana Health Service, were their response also in line with what you were thinking?
Yeah, they were all for it. They were all for it. And you see, they have constraints. And they were saying that it is the institutions that should set it up and also be able to, finance it from their finances in IGF. And it should not be a burden on the health service. Oh. So in principle, they agree completely.
So you're saying that for every school in the eastern region, right, who are going to be getting doctors would have to fund for these particular paramedics who will be in their schools?
Yeah, that is what we are saying. It's cost effective and it protects everybody. It also dispels, rumors of lack of sympathy or, waywardness on the part of maybe the administrators. Teachers, management of the schools, they are parents. In education, we say they are acting in locus parentis. So if you are a parent in the house, what do you do to forestall certain emergencies? That's what we are advocating for.
But this is the case where students are asked not to pay anything. Schools are not supposed to charge students any amount of money. How then do we expect that these various schools manage to fund these paramedics, even though you say it's going to be cost effective?
Oh, I don't think PTA and other donors have been banned from contributing to running schools. PTAs are building they are making projects. Some are building assembly halls, bungalows for the tutors. Some are buying buses. And so I don't think it will be too much for, stakeholders in a particular institution to be told that to actually stem the tide and to make sure that we have somebody on hand, readily on hand. to take care of the health needs of our kids. I don't think it will be too much for them.
Now, do we have any particular timeline to achieve this particular proposal you're bringing on board?
Well, it's a proposal, and I think we need to discuss it and find space in the thinking of other people, other stakeholders. I believe people will actually come on board.
Do you think that this is going to be very feasible? How sure are you that even if the PTA and various schools agree to this, we are going to have this sustained for a very long time?
My dear sister, I just want to be optimistic. I mean, we are growing a society. We are developing, and best practices can always be emulated. So I'm not saying. I mean, this is not law. It's a proposal. It's a social issue, and I think we all need to come on board. And I believe people will take it on board and want to implement it. We will need to continue to discuss it seriously, because the teachers are also stressed out. So I mean, it will help. Well, I'm hoping it could be compulsory, and it will be facilitated by the Ghana Health Service, because the moment you set up a health facility, a health point, the Ghana Health Service has the onerous duty to ensure that you are doing the right thing, even if it was private. They will have to come and do inspection and make sure that the procedures and the line of application of medicines and whatnot, if it is made compulsory, maybe by legislation or by a policy coming from the Ghana Education Service in conjunction with the Ghana Health Service, it will be the best.
So those are the solutions that have been suggested by the Eastern Regional Minister, Eric Kwache Dafo. Let's delve deeper into this issue of healthcare in senior high schools, and we've been joined by presidents of the Coalition of NGOs in Health, Gabriel Benaku. Good afternoon. Good morning, sir, and welcome.
Yeah, good morning.
Yeah, thanks for joining us. Now, let's take a step back a bit and look at this issue on a larger scale. We have about 3 or 4 outbreaks in a matter of weeks because St. Martin's Senior High School also had some students fainting. What do you think has brought about this recent spate of disease outbreaks in schools?
Okay, thank you for giving us the opportunity to contribute to strengthening our health systems in Ghana. In the first place, we are still stressing on the point that we have a very weak health system in Ghana. That's the first point. Secondly, when the Kumaka 1 happened, we demanded the Ministry of Health, Ghana Health Service, to take proactive measures to ensure that a lasting solution is found and possibly have a clinic within Kumaka. It never happened. We never saw the report of the Kumaka 1. Now we have Kumaka 2 that is now affecting the other schools.
So you're referring to the April outbreak?
Yeah, the April outbreak where we lost life. They did all their necessary investigation. What have they done with the report? Why did they sit down for 7 months for a second outbreak? Why didn't you know the early warning sign? The health system should take care of that. For the health leaders to sit down since April till November, December, where we have a second outbreak in the same facility, and when the incident happened, they didn't have any systems within the school to respond to the emergency. Even when a team was dispatched from Accra, when the minister was speaking at Parliament, he said the team was already in Kumasi, and still the situation was worse. And we cannot understand why in Kumasi we can't have a very robust laboratory to be able to diagnose some of this nature, except that we have to transport to Accra, Noguchi, or Tamale. So it tells you that totally our health system is very, very weak. And we want to stress on the point that it's high time the Ministry of Health took a very strong leadership position in financing the health system. Thirdly, when the issue happened, I remembered your team called me and we made an input. And what we said was that the ministry should immediately support Ghana Health Service to decentralize and finance the surveillance teams in the regions. As we speak now, what is the plan the country has for such a situation? We haven't seen anything happening. So we are just pouring water on rocks. When are they going to wet for us to break the rocks? So it just tells you that we have very weak leadership in terms of their attitude towards financing emergency healthcare in the country.
Right, but some of these challenges have been in existence for years. But this year in particular, we are seeing an unnatural outbreak or, spate of these outbreaks in
When
schools.
the Kumaka one happened, our health system should have learned and be able to create all the necessary emergency responses across the country. And so when the second one happened, and we already know that it's H1N1, and if you listen to the regional director of health, he said they are already aware. If you are aware, the health system should be able to respond to it in all the schools. Mind you, the population we have in Ghana now is almost double as last year. So if they are already talking about meningitis, the health experts know the meaning of that. The health experts know that once we have double of the number in the schools, it is
so you're
time.
speaking of the population in the schools.
Yes.
Being double, almost double what it was last year.
And so Ghana Health Service, Ghana Education Service, when Kumaka 2 happened, should be able to know immediately that there could be possible outbreaks in other regions because there have been moves here and there. And so we cannot understand why up to now they have not put in place a robust emergency plan and financing the situation, and we are still allowing children to be dying. That's why I'm saying that it's high time the Ministry of Health took a very strong decision to finance clinics in all public and private secondary schools in Ghana.
Well, it's in the summary report that was released after the second outbreak, the H1N1 outbreak in Kumaka, what you would refer to as Kumaka 2, that every school must have a hospital, in fact.
But we are talking about the emergency now. Something must happen immediately before the immediate strategy put in place. And I'm talking about now, what is the Ministry of Health, Ghana Education Service saying now about the entire nation? All secondary schools in Ghana, what is the position of the Ministry of Health, Ghana Education Service right now as we speak now? If you talk to every child in every school now, they are already aware and they are panicking. And this is the time they are writing exams. So we are already creating depressional conditions associated with this meningitis and H1N1. Are you getting it? So we are not even talking about just the outbreak, but our inability to deal with the emergency is creating another panic, and that is depressional.
So you feel that the Ghana Health Service should have been able to anticipate the danger of such disease outbreaks, especially with the increased numbers in our senior high schools.
Exactly, especially when they knew that meningitis spread faster through contacts, especially when they knew that H1 also spreads through the same mood, especially when they knew from Kumaka 2 that there are possible trace people who could have moved to other regions. And the minister talked about it, but they relaxed. They said they are in control, and they are not really in control. Now we have more than 5 now schools being affected.
Well, it's four that we've counted.
It's 4 now. Okay.
It's 4 that we've counted. You feel that these outbreaks in these schools are because of the increased numbers because of the free SHS system?
I would say the increased number of students, not the free HSS. For free HSS is a policy. But we are talking about public health intervention, where there's an increase in population and there's an outbreak. The possibility of the spread is much faster than when we have less dense population. And so the Ghana Health Service knows this. They already know that this is a common public health.
So they should have put some policies in place beforehand. That's your position.
Strategies. We already have a public health policy. When there's an outbreak, these are the emergency plans. Either WHO plan or we are using the country strategy.
Okay.
Each of them has a very robust system that we need to finance.
Okay.
So it boils down to financing the emergency situation now, which is not forthcoming. Ghana Health Services, they are ready to work. The Minister of Health, Minister of Finance might release funds to ensure that all public schools, both public and private schools, get the necessary logistic and human resource to be able to start the surveillance and early warning sign. You see what happened in Damongo? It's because they are detached. Otherwise, if you had put in place, just after the minister announcing the result of the test, if they have put in place measure in all secondary schools, that child would not have died yesterday. And so it is purely lack of commitment by the leadership of the health sector to finance the emergency situation in the country right now.
But these diseases are very widespread. Wouldn't it be presumptuous to link the outbreak? You know, we have meningitis was in the eastern region, Koforidua Senior High Technical School. Then it goes to the northern region, Damongo. I mean, isn't it too far apart for us to put them, link their
in science? In science, not too far. It's much closer. Somebody can be in Zambia right now. In the next 2 days, he's in Ghana. In the next 3 days, he's in Burkina. So you can imagine. Is it far? No, because of technology, because of work. Everything is possible now. What the advantage we have is that we already have a public health system. What we need to do is let's finance. When there's an emergency, let me give you a typical example. Last year, when there was an outbreak in the Thai district, Manukoka meningitis, the coalition made a strong position that Ghana Health Service should step out to manage the situation within time and at the same time put in place measures nationwide. They didn't listen. In 3 weeks' time, 8 regions were affected because people moved. They are traders. People have relatives. People go to work and go back. So it just tells you that our public health system should be able to decentralize our systems, programs, to be able to respond to emergencies anywhere. Once there's an outbreak, the system should be able to. We are not getting the funding. They are not getting the funding. I should put it that way.
Isn't it simplistic to say that it's simply a lack of funding that is causing this thing? Some would say that you don't solve the problem by throwing money at it.
There's considerable human resource in Ghana Health Service that if adequate logistics are provided, they will do a good job. But I'll tell you, the coalition work in 201 districts out of the 216. And by just our platform, we understand whatever challenges is going through the country. The Minister of Health, Minister of Finance just need to finance the Ghana Health Service to be able to respond to their mandate. It's a very simple strategy.
Okay.
Financing our health systems, both human and logistical, to ensure that the human resources are able to deploy their expertise and skills to respond to health needs of this country. That is what we are not doing now.
Let's talk about some of the things that we must do now. You earlier mentioned that these students are in the examination period. Your point you were making, of course, at that point was that mentally they would need to be psyched up to write the examination by not being afraid of diseases. But then examination means vacations are coming soon.
Yes.
And looking at the nature of some of these diseases, some of them have a longer incubation period. You will not know they are affected till they possibly go home.
Yeah.
Are we in danger of this pneumococcal situation you mentioned, where there were a number of people in one place and they spread geographically and the diseases spread across the country? Is there any possibility of that?
We are in danger already. Not are we going to. We are in danger already. We are in a crisis in terms of public health understanding. Once we have more than one school affected, once there's an incidence of different types of diseases and infection going on, that means there could be multiple effects. And so
what multiplied effect means?
Multiplied effects means that people can crisscross. Somebody can move in the event from Kumasi to Eastern Region, from Eastern Region to Central Region, and from Eastern Region to Techimai, which is in the Brunahafo, and it can have other effects. And for example, today, if you are in the Brunahafo, maybe Sunyani, that's the market day, or Techimai, you have students coming in here and there, and somebody move. So it tells you the connections, how people get infected. Now, the first thing Ghana Health Service needs to do is to roll out their public health education system. They are dormant now. Apart from the private media, I'm not even seeing the public media educating the public about what is happening, apart from the normal news. That is one. Apart from the civil society calling on government to do ABCD, we are not seeing the public health unit, the health promotion unit of the Ghana Health Service playing their role. They are specialized in providing education, information about any outbreak, about any health information issue. Where are they? That is what I'm calling that we have a very weak system and we have very poor financing of public health emergencies. We are supposed to be seeing locally made messages that will be targeting the Gan people, that will be targeting the Ashantis, that will be targeting the Dagombes, that will be targeting the Dagabes, that will be targeting the Evers, and other equally important Ghanaian languages within the local context. Where is the collaboration between Ghana Education Service, Ghana Health Service, Health Promotion Unit, to be able to relay the information back to the public? Where are the clinical psychologists who are supposed to go back to these schools to provide a psychotherapeutic interventions for these children to have peace of mind to write? Otherwise, they will also develop depression. And depression condition, if lasts for some time, can also lead to other complex mental health conditions. So we are in a very complex situation, but look as if we are looking at it at 4 or 5 schools affected. We are not thinking that it's a national issue. We, the coalition, think that this is a critical national emergency response that Ghana Health Service, Ministry of Health must roll out their emergency educational packages right now to ensure that all the regional surveillance, all the regional health management teams, all the district surveillance teams are properly activated and financed to be able to communicate effectively to the population.
Okay. Thank you very much, Mr. Benako, for joining us. He is the president of the Coalition of NGOs in Health.